Today's topic is on stroke, CVA, the cerebrovascular accident. This is one of the most common diseases that we come across in our medical fields. So it is very important that we understand this. And what stroke really means, cerebrovascular accident, this is a sudden impairment of blood flow to the brain or to the brainstem in less than 24 hours. So for us to get an understanding of cerebrovascular accident or stroke, we need to know the blood supply to the brain so that we know how this disease comes about. So the first thing that we are going to do is we are going to draw the brain, and we draw the arterial blood supply, the diagram of the arterial blood supply to the brain, so that we know how this disease comes about. So the first thing that we're going to do is that we're going to draw the brain from underneath, looking at it from underneath, of course not the side. Of course, this is the brain stem. This is the brain, this is the brain stem, and then this is the underneath of the brain. And in the brain, there is the circle of Willis that supplies the brain, all parts of the brain, with the blood that comes from the heart. And this circle of Willis comes from a lot of different arteries joining together, forming in a shape, a circular thing like the circle. That's why it was called, it was referred to as the circle of Willis, because it forms a circle of arteries in the brain. So we've drawn the brain. This is the frontal lobe, the front part of the brain, the middle part of the brain, and the posterior part of the brain. So we are going to draw the circle of Willis. We imagine that circle of Willis, it's the circle of arteries taken in from the bottom part of the brain, because the brain is the brain is supplied with the blood which is coming from the heart, and that heart has got a branch of arteries. When they go to the brain, they form a Willis, a circle like. That's why it's called the circle of Willis. So we take the circle of Willis. This is the frontal lobe, frontal part. The frontal lobe. Of course, you can see that it's forming a circle of Willis, probably after the guy that discovered it. And this artery, this is the basilar artery. It goes down in from the brain towards the spinal cord to meet with the vertebral arteries. There are two vertebral arteries. Of course, one comes from the left subclavian artery, and then the other one comes from the right subclavian artery. So they bifurcate at the level of the spinal cord. So this is so imagine this is my left hand side. So this is the left hand side of this part, and this is the right hand side of this part. So this is the basilar artery. And these are the two vertebral arteries. There is the left vertebral artery and the right vertebral artery. So together they are all called the vertebral arteries. And this is the posterior, because this is the posterior part of the brain. This is the posterior part of the brain, so it's called the posterior artery because it's going to supply the posterior part of the brain with the blood. And of course, since all of these arteries are in the cerebellum, so it is very important to refer to them as cerebral arteries. So there is going to be the posterior cerebral artery, and there is going to be the middle cerebral artery because it's in the middle. And these are the middle cerebral artery joins in with the internal carotid artery, which comes from the lower part of the body. So there's going to be a branch of the carotid artery. So this is the carotid artery. Even here. So all these two are called the carotid arteries. This one, of course, is also the posterior cerebral artery, and the middle cerebral artery. This is the anterior cerebral artery, which supplies the frontal part of the brain. This one supplies the middle part of the brain. This one supplies the frontal part of the brain. Or the anterior cerebral artery. So blood is going to come from the body, from the heart, travels to the brain through the circle of Willis and supplies different parts of the brain. The middle part of the brain is going to be supplied with the middle cerebral artery. And then the posterior part of the brain is going to be supplied with the posterior cerebral artery. The anterior part of the brain is going to be supplied with the anterior cerebral artery. And this joining artery here this is the anterior cerebral communicating artery. It joins the anterior arteries together. There's another one also in the posterior lobe. It also joins the posterior arteries together. So it's also called the posterior cerebral communicating arteries. Now that we understand how the blood flows through the brain, we are now going to our definition of stroke, because stroke is a sudden impairment of the blood flow to the parts of the brain or the brainstem within 24 hours or less than 24 hours. That's what stroke is. It's just a sudden interruption of the blood flow to the brain. Now, having talked about this, we are going to talk about the causes of stroke. What causes stroke and the types of strokes. So the causes of stroke. And stroke is primarily caused by two causes, and these can be identified as ischemic causes or hemorrhagic causes. And this ischemic causes is the type of stroke where we have the part of the brain is not being perfused with a lot of blood or without blood completely because of the certain conditions, for example, the disease process of atherosclerosis, resulting in the plaque formation in an artery. For example, in the carotid artery, there could be a plug forming, and that plug, when it bursts, it's going to cause the thrombus. And when a thrombus bursts also, it's going to result in into an emboli, and then an emboli will travel through the bloodstream and then goes to the brain, also reaches the middle cerebral artery, and then causing stroke, or it's going to cause a blockage of the blood supply to the central part of the brain, and that can result into a stroke, what we call sudden impairment of blood supply to certain parts of the brain, and that can lead to brain infarction. There is going to be death of the brain cells, tissues, because of the sudden loss of blood supply and oxygen. And brain tissues and cells are the types of cells in the body which are very impossible to be replaced once they are damaged. So there is going to be damage to brain tissues. Of course, this disease can be treated, but it cannot be cured. The brain stems which have been damaged, they can never be replaced. That's what ischemic stroke is all about. So to get a deep understanding of this ischemic stroke, we are going to draw an artery so that at least we know what is happening inside our blood vessels. So let's imagine this is an artery. Of course, the carotid artery taking blood from the lower part of the body to the brain. And then inside the artery, because of high fatty foods that we eat, there is high cholesterol levels in those high fatty foods. Hence, that is going to cause some of the plaques to start forming inside our blood vessels. They're called the fats. So there's going to be a fat formation. The plaque starts forming inside the blood vessel, and then when this plaque bursts, it's going to form a thrombus. It's going to form a thrombus, and the thrombus will result into an emboli. An emboli will travel to the bloodstream, in the blood, to the brain, and then it will cause stroke. It will cause a blockage in one of the arteries, commonly in the middle cerebral arteries, and as a result causing brain infarction, death of the brain cells. That's what ischemic stroke is all about. The other cause is hemorrhagic cause. Hemorrhage is bleeding. So as a result of, for example, if the patient is hypertension, there is going to be an increase in blood supply to the brain. There's going to be a large amount of fluids inside the blood vessels, and then that can lead to aneurysm. There's going to be swelling in the blood vessels. As a result, due to the intravascular pressure which is in the arteries, the artery can burst, causing hemorrhage, and then hemorrhage will result into intracranial pressure. And then as the arteries are bleeding, there's going to be a loss of blood supply to some certain parts of the brain, through which the arteries have not yet reached or have not yet perfused. So that's a hemorrhagic cause. The next thing that we want to talk about now in the next video, we are going to talk about the predisposing factors to our stroke. and then we move on to talk about the clinical signs and symptoms, and then we also talk about the management of our stroke.